When most people think about a diabetes diagnosis, they imagine a sudden event. You go in for a routine checkup, the doctor runs a standard blood panel, and you are told that you have a chronic disease. But metabolic decay is rarely that abrupt. In reality, the physical damage has often been compounding beneath the surface for 10 or 15 years before a standard fasting blood test ever flags a problem. The quiet precursor to this shift is a condition known as insulin resistance. This is the physiological state where your cells stop responding efficiently to insulin, the hormone responsible for moving glucose out of your blood and into your muscles for energy. This balancing scale shows how the disease hides. A patient can take an HbA1c test, a measure of average blood sugar, and score under 5.7%, which appears normal. But that sugar level is only stable because the pancreas is working in overdrive, pumping out massive, unsustainable amounts of insulin to force the stubborn cells to accept the glucose. A blood test in this early phase doesn't necessarily indicate a healthy metabolism. It often masks a pancreas that is redlining at maximum capacity to keep the numbers within the lines. Even when the blood tests look fine, the body begins sending physical distress signals. People dealing with high insulin levels often experience persistent hunger, severe energy crashes, and a lingering brain fog shortly after eating a meal. This graph maps why those crashes happen. To overcome cellular resistance, the pancreas releases a massive surge of insulin. This surge sweeps the sugar out of the bloodstream so aggressively that the curve crashes down. The brain interprets this rapid drop as a crisis, triggering intense sugar cravings to pull the levels back up. That cycle leaves visible markers on the body: the accumulation of central belly fat that resists weight loss efforts, the appearance of skin tags, or a condition called acanthosis nigricans, velvety, dark patches in the creases of the neck. These skin changes are a direct response to the hormone imbalance. High levels of insulin act as an aggressive growth factor, physically forcing skin cells to multiply faster than they should. When these early distress signals go ignored, the body's hidden compensation mechanisms eventually fail. The tipping point arrives when the exhausted pancreas can no longer produce enough insulin to overtower the body's resistance. Without that hormone forcing the issue, blood sugar levels finally begin to rise. A healthy fasting blood sugar sits below 100. As the pancreas weakens, the morning glucose reaches 100, entering the prediabetes warning zone. The diagnostic threshold for type 2 diabetes is 126 or above. The pancreas can no longer keep pace with internal resistance. Doctors confirm this with the HbA1c metric, which records a 2 to 3 month historical average of blood sugar. By measuring the glucose permanently bonded to red blood cells, this test accounts for long-term exposure. Crossing these thresholds is more than a change in medical classification. It is the biological moment your blood becomes chemically corrosive to your own body. High glucose acts as a slow-moving toxin inside the circulatory system. Over time, the excess sugar causes the inner walls of the blood vessels to progressively stiffen and narrow, which restricts the flow of blood. The immediate consequence is that the body's extremities, particularly the feet and hands, are slowly starved. The restricted blood flow means the tissues there receive a fraction of the oxygen and essential nutrients they need to function. This lack of blood flow leads to diabetic neuropathy. Prolonged high glucose specifically destroys the fragile, microscopic capillaries that nourish your nerve endings. As the nerves die, patients experience prickling and burning sensations in their feet. Eventually, that pain fades into a complete loss of feeling. The patient is now caught in a biological trap. Their lower limbs are operating entirely blind to pain, while being simultaneously starved of healing blood flow. The combination of neuropathy and poor circulation creates a dangerous cycle. The inability to feel pain makes injury likely, and the lack of blood flow prevents those injuries from closing. The sequence often starts with a minor blister or a small cut on the foot. Because the nerves are damaged, the injury goes completely unnoticed for days, hidden inside a shoe or sock. Bacteria thrive in the sugar-rich environment of the open wound. With the immune system already compromised, the infection aggressively multiplies within the tissue matrix. What began as a minor blister can progress into a deep foot ulcer and tissue death, or gangrene. To stop the infection from entering the bloodstream and becoming fatal, surgeons may eventually have to remove the limb. Late-stage amputations are the culmination of a decade where the body's early metabolic warnings were either suppressed or missed. Clinical outcomes show that this metabolic decay is not an inevitable sentence. When caught in the pre-diabetic phase, the underlying dysfunction can often be addressed before structural damage to the nerves and vessels becomes permanent. Recognizing the early physical signs of insulin resistance or a fasting sugar of 110 isn't a failure, it's a window of opportunity. It allows for intervention while the body is still capable of self-repair. Changes in diet, active weight management, and intermittent fasting target the root of the problem by reducing the constant spikes in blood glucose. This return to our balancing scale shows the biological logic behind remission. By lowering the daily demand for insulin, the pancreas is allowed to rest, cellular resistance fades, and the scale levels out, letting blood sugar stabilize without the added weight. By tracking the metrics that go beyond a simple fasting test and listening to the body's early physical signs, the progression of diabetes can be intercepted before it ever has a chance to build in the shadows.